A health tip brought to you by Professional Orthopedic Associates.
Hello, I'm Dr. Greg Foos. I'm a board-certified orthopedic surgeon, fellowship trained in sports medicine. I'm here to talk to you today about shoulder instability. A dislocating shoulder is a big problem for many people, oftentimes in athletes and particularly the younger patient population. What we typically see with shoulder instability is a shoulder that dislocates. These episodes are usually traumatic, oftentimes associated with a fall on a shoulder or other types of trauma that can force the shoulder out of the socket. Although the treatment initially is to put the shoulder back in the socket, which typically occurs during the course of a trip to an emergency department, our biggest problem with these disorders are that they tend to be recurrent. A very high incidence of recurrence occurs. Some people feel it's upwards of 80% of young athletes will develop recurrent episodes of instability. When we see this situation where a shoulder continues to come out of the socket, it oftentimes requires other types of treatment. Although physical therapy can be helpful to strengthen the muscle around the shoulder, oftentimes these shoulders require some type of surgical repair. In years gone by, the surgeries were performed through open procedures, which were involved with a very long rehabilitation time. Nowadays, the technology has improved so that many times we can do these surgeries through small arthroscopic approaches. Essentially what that means is that we make several small incisions around the shoulder and insert a camera into the shoulder joint to be able to see where the damaged ligaments and capsule are. Repairs can be performed, and oftentimes this will result in a shoulder that has perfect stability and being able to return the patients to normal sports and normal activities without recurrent pain or episodes of the shoulder coming out of place. After a surgery, typically people require a period of immobilization in a sling and followed by a structured rehabilitation program, oftentimes performed under the guidance of a physical therapist. To determine if you have this type of a problem or whether you're a candidate for surgical treatment, we should have you see your orthopedic surgeon. Thank you.
This has been a health tip brought to you by Professional Orthopedic Associates.